So you're gonna start fairly high in the groin. You've gotta stay high in the groin because what happens is people don't wanna get so close in the groin and they don't come up high enough, and then fluid can start to pocket in through here. And then it's called an adductor roll. And then when it does come time to get fitted with a prosthesis, they've got this extra bunch of skin and fluid here, and that's not gonna be comfortable. Everyone's like, exactly. So we don't want that to happen. So you're gonna start right in line with sort of the inguinal line there, come down over the outside corner. And this one's nice because you come right back over your starting point right from the beginning. So now you don't have to worry about holding that on. So a little pressure down through here, then we could have our patient side lie. We're gonna anchor around the waist. So again, we're now just kind of laying it down right on top. I'm just kind of unrolling it right on the skin. I'm not really pulling a whole lot. You're gonna come back over towards this hip, and then you're gonna come down the back side of the leg again. Make sure you're not, again, getting too close to the buttocks there. I'm gonna take this one and I'm gonna come up as high as I can get through the groin because again, I don't want that adductor roll to form. And again, your patient can abduct their legs for you, so they can kind of help out with this process. So I'm gonna come high up through there, and then you're gonna go back up around the hips again. And you should end up, for the most part, most of these bandages are a pretty standard length. You're probably gonna end up running out of roll somewhere up in the waist. It can be in the back, the front, side, but probably somewhere up here in the anchor is where you're gonna run out of wrap. So we're gonna tape that down there. Thank you, patient. All right, so with our next 6-inch bandage, you're gonna do the same thing. You follow the same pattern. You're gonna go around, once around the residual limb, once around the waist, again around the residual limb, and end up probably somewhere in the waist. By the time you get done with your second 6-inch, there should be no skin showing in the residual limb. So you should have all of your holes covered. So I'm gonna look and see where I have my holes before I start this one. So I have a fairly big hole down here at the bottom of the residual limb, and just a little tiny sliver over here. I've found from doing this, it's easier to cover up this little side hole, if you have one over here, to start, versus trying to cover up this big one right away. I'll get to it. So to cover up this one, I'm actually gonna start a little bit higher this time, but still at the same angle, still in kind of the same place. So I'm gonna come down over here, over the outside corner, up over the inside. Make sure your corners of where you started from get covered. If that's left out, it doesn't take very much for that to snag on something and it starts to unravel everything that's been done. So make sure those get covered. And then you'll have your patient side lie, lay this around the waist. Now I'm gonna come down and I'm gonna kind of exaggerate this angle a little bit because I really wanna be able to come up. I don't like that, I'm gonna roll it back a little bit. So you can do this during a comp, it's fine. And we're gonna end up here. All right, so now smooth out the wrinkles. Nice and loose up there. And we should have everything covered down here. All right, so everything's covered. Now what we're gonna do with the 4-inch is we're just gonna apply more pressure. Okay, so the main job was 6-inch, yes, more pressure down here, not so much up here, but coverage. Get full coverage with your 6 inches. Now with my 4-inch, I'm just gonna basket weave and I'm gonna add more pressure to help encourage fluid return. Start right on the front for this, it's gonna make it easier for you. Come down over one corner, up over the other, cover up where you started, and come straight through the back. That's your figure 8. All right, if you keep doing this, just repeat that pattern. Corner to corner, and then across the back. You should see this little basket weave starting. When you get towards the very bottom, it gets a little harder because you don't have as much, you're running out of angles to kind of play with here. All right, so we're gonna end up, I'm gonna have the person roll over because it's Good for them to land prone or sideline anyway. And we're gonna tape off. So this one turned out a little bit better than the last one. I've got no holes. I would ideally like a little more coverage down here, but you've got everything covered with bandages, so you're not gonna have any fluid, and you've got some pressure build up through here to help encourage the fluid return. So again, we're gonna look for wrinkles, we're gonna look for coverage, we're gonna look for tightness up here versus down here. Does it feel fairly evenly distributed?